everybody. Welcome to the Technology Evangelist podcast brought to you by Medidenta Digital. I'm Dr. John Fluke, Technology Evangelist. And one thing I want to say is likes and comments and subscriptions help us a ton. So if you want to do that, any comments are welcome, or any guest suggestions, I always welcome those. Today, I have got this is going to be a good one because this is a super cool guest. He's doing a lot of really amazing stuff. And we're going to get into kind of the future of where dentistry and implant placement and surgeries are heading. So, grab some popcorn and sit down. My guest this week is Dr. Mark Whitefield. Mark, thank you so much for spending some time with me today.
Oh, thanks for having me, John. This is like Christmas to me. This is a treat to talk with you.
Well, thank you. Mark, I always start off with an origin story. So before we get into the cool stuff you're doing now, do me a favor, kind of wind the clock back, go back as far as you want. Mine goes back to age 3 when I decided to be a dentist, but take me back as far as you want and tell people how you got from where you started or what got you into this to where you are today.
Well, I guess it started about 125 years ago. I'm a fourth generation dentist. So about 10th grade, I decided, well, I'm not going to be in the NFL anytime soon, so I guess I'll be a dentist. And it was from that point on, it was kind of where we got to. I very lucky. I got to practice with my dad for about 20 years. And I've been practicing dentistry for like 30 years. And I very lucky got to practice with my father for about 20 years. And that's really what I count that a blessing, because my dad and another one of his buddies who we went to church with, we did a lot of missions with, it was a periodontist, John Peden. And looking back on it now, they were true implant pioneers back in the like early 80s when
Wow.
they were trying to, just learn how to do implants and make them work. And to be honest with you, now that I look back on it, that's really the thing that really kind of set the tone for my career. So I learned implants from them, and I got to see. I really have gotten to witness pretty much the entire history of implantology from its inception. And now this is why I get so amped up and excited about it, because, talking with you, but the technologies that are coming out are just amazing. And that, that's where we really apply them in implant dentistry, implantology. But when it really boils down to it, this is awesome because we're giving people something like real teeth again. And I think that's a real thing that we in dentistry as a discipline need to look forward towards more on down the road, so that we can do this and increase people's longevity. So anyway, that's kind of my mission in life, is to make implants more affordable, available for more people, so that we can get them to live longer.
Well, and I think this segues really well into our discussion, because what you're trying to do is to make implant surgery easier and more
Yeah,
predictable
yeah.
for the doctor, which then comes back to the benefit of the patient. It's funny. I can remember you talked about implants in the 80s. So the only implants that I ever saw when I was getting trained in school was dentures on subperiosteal implants. And we had a
Yeah.
guy that was a prosthodontist, who was the chairman of the prosthodontic department. And he would sometimes, throw up some slides and show these
Hmm.
things. But I mean, the way the whole concept, from subperiosteal, arch kind of things, laid down on the bone, to being able to do what you're doing now. Bring us up to speed a little bit. because I want people to know when you were telling me this when we met, I was just blown away with this. So, kind of give us an idea of how you're doing implants now compared to like the way probably what 95, 99% of people are doing them other than you.
Yeah. It is so interesting that you bring that up because, Hilt Tatum was one of the obviously pioneer, I mean, one of the real true innovators. And he died last year. And I look back to guys like Hilt Tatum and then even Carl Mish.
Yeah,
And that's who my dad and that's who John and them trained under, and they were true technologists and innovators. I mean, they had to make stuff up. They had to create their own instruments. And so, I know that history and I know how freaking hard it is. But now going forward, uh, I'm just amazed at the abilities and skill sets and the things that the technology is letting us do, but it's foundationally building upon our previous knowledge. So comparatively speaking, for full arches, yeah, they started off by doing subperiosteals, and those are wild. I mean, to be honest with you, I
oh
admire
yeah,
that guy for trying those. Um, the concept, and this is a good segue because the first, first off, I went to UT. They didn't teach us anything. They didn't teach us one single thing about implants, and they still don't teach a lot. But most schools don't. Um, but then you get out and you've got lots of patients. There are 38 million Americans that are edentulous in at least one arch. That's a lot of people who,
that's a huge number.
yeah, and it's growing every day. And so I get out of school in '95, and then I have these patients come in, and I'd be like, "Okay, Dad, what do I do with this?" And we started off with locators, doing those, and they did well, but I was always looking for something better. And I remember doing my first all on X. There was one day that I did two cases with Dr. Peden. One was an all on X screw retained on the lower arch where we screwed an acrylic denture in.
Right.
And then in the afternoon, we did an all on like 8 or 9 implants and we cemented it and on the lower arch, and that
Okay.
was on and they were on two people that we knew, and it was interesting because that was my first introduction to full arches, and then I was like, wow, this is some complex stuff. And when I say the complex stuff, it's talking about the restorative portion. It's really hard, and then again that was 20 years ago, and so screw retain since then has grown. And I've never loved screw retained. It's just complex. I mean, it all, the genesis was that first day. It's not bad. It's just very, very complex and kludgy. And I've long thought, hey, we ought to be able to do something better, or somebody ought to iterate something different. And through my struggles and experiments and iterations and failures, like massive numbers of failures, we have finally come down to what I consider to be. I use the term Holy Grail. I'm not trying to,
No, I get you.
bloviate or anything
Yeah.
like that, but it's pretty magical for me. And what that is fixed removable attachments, which are they are similar to locators. They are locators, but they operate when it's in the mouth. They operate in a fixed manner. But by combining that with AACD level cosmetics and the latest materials, titanium and nano ceramics that we overlay with that, we can now create full arches that are supported, fixed, supported by all on however many implants you got, but they look like they're beautiful, but they function like fixed, but they're removable and they're easy to maintain and easy to repair if we had to. So that's the point that I'm at now, that we have finally discovered. Wow, this is something that the average old dentist like myself, I can actually implement, and the ultimate thing is we can offer it for about half the cost of all on X screw retained zirconia. So
Well,
I'm just excited about the whole situation.
I mean, that's huge because
Yeah.
you mentioned a couple things. I'm gonna go with the cost part of it first,
Yeah.
because we have amazing abilities in dentistry now. I mean, amazing surgical techniques and amazing materials.
Hmm.
Um, if you and I'm not trying to be funny, but if you walk around with 100 grand in your pocket and you
Yeah.
want a perfect mouth, we can get you pretty close to
Yeah.
perfect. But the problem is not everybody's walking around with
Yeah.
a pocket full of cash, and somebody, when in the probably the height of the cosmetic, in my opinion anyway, probably the height of everybody wanting to be a cosmetic dentist, it seemed to be about 2005 or 2006, right before the big financial crash. And
Hmm.
I remember a friend of mine told me one time, and I thought this, I think it's funny because we can all occasionally say profound things, even though we may not realize it when we say it. But this friend of mine said, he said, the problem with everybody wanting to be Neiman Marcus is who takes care of the people that can only afford Walmart?
Right.
And, so being able to offer things that people, can afford, and still function and live with, I think is huge. The other thing you said that I want to make sure I point out is you said after failures. And that's something,
Yes.
you watch a podcast, or, you watch a webinar, you go to a lecture and you see this incredible stuff. But rarely do people say, oh yeah, and I had to mess up 10 times, before I got to this point, or
Yeah.
whatever. And I've always said you learn tons more from your failures than you do from your successes. And I love the fact that you brought that up because, people are going to look at someone like yourself and think, oh my gosh, well, he's got this incredible skill level. I'm never going to
Yeah.
get
No.
that. But you worked to it just like we all did. It's not unachievable. It just takes a lot of hard work, and you've put that hard work in, and I think that's admirable.
Well, I appreciate that, and it's interesting that you bring these up because I'm both AACD and AAID accredited,
Wow,
and you
didn't
would
know
think
that. That's
you
cool.
would think, well, it only goes so far. And because you would think that I would have all the answers. That's it's on the other end of the scale. And it's funny because I went through AACD first, very high end cosmetics,
Yep.
uh, porcelains, just exquisitely beautiful work. And then as I was going through that, I was at the same time I had all this big library of patients that were like coming in just needed teeth again,
Yeah.
and so I did AAID accreditation, and it's just funny because there's a thought process just across the entire landscape, whether it's exquisite cosmetics or really large surgery cases with restorative in both academies, and this has always bothered me. And again, I'm a big advocate of both academies or whatever lectures. Nobody talks about cost, and
Yeah.
I mean, everybody just acts like everybody's walking around with $100,000 in their pocket. I'm like,
Yeah.
man, I mean, I'm here in Nashville. We don't have that, and so I long thought that um, I long thought that somebody somewhere needs to invent something or iterate something where the average person can get exquisite AACD level type cosmetics, but also get an extremely functional system to masticate. I mean,
Yeah.
really, and then create it so that it's affordable for both the dentist and the patient, uh so that we can address this missing need for the 38 million people that just don't have teeth.
Yeah. Because flat out. Heck, if you got Google, you could probably Google it and find out. But the majority of those 38 million edentulous people, there's only a tiny percentage of those people that have the kind
Right.
of cash that it would take for this high end. Um, I want to segue a little bit because we're staying in this category, but you and I had a super cool
Yeah.
conversation about AI. So
Yeah.
bring everybody up to speed on what you're doing in that realm because I think that is just fall over
Well,
dead cool.
it is the catalyst, or what they refer to as a GPT, a general purpose technology, which is like electricity or cars or iPhones or computer, internet, whatever. It's a general, it's a general technology that multiple people adopt and it diffuses through the landscape. And what I saw, this was wow. I mean, time just runs on. I mean, this is before COVID. We're using photogrammetry. We're using some. We're playing with some pick systems. I was the first doctor around to purchase a Cerac back about 25 years ago here in Nashville, and you and I spoke about that.
Yeah.
But the world of AI has really given us dentists, especially implant dentists, not just implant dentists, restorative dentists, abilities and skill sets and superpowers. I mean,
Uh,
they are superpowers to let us do better dentistry, but we also do it in a much more cost effective manner. And it's very, and I've just become obsessed with it because I see all these different tools that are coming out, and that's kind of what I do. I grab things and I play with it and I fart around with it and I fail and experiment. But I'm super excited because now going forward, you know, next year, 3 years, 5 years, 10 years from now, man, it's going to be crazy different with the emerging technologies. But realistically, the top technologies that we have available to us today, they already let us do things that we could never do before. But again, it makes it affordable and it makes it the accuracy isn't increased. But the big thing far and away, and this is what we do, and we teach through our arch intelligence training, is we train dentists to actually okay, say this is the technology. This is a technology that works real well. This is the problem solution benefit cascade. This is your ROI, and then we show them how to actually use it. We put it in their hands, we train them, and we hold their hands through it. And that's something and that's been a big problem in dentistry. I mean, you know more than anybody. I mean, there's so many technologies coming out that they throw at us, and they say, "Oh, you can use it." Maybe yes, maybe no. We're dentists, not graphic designers or programmers or whatever. And so that's why I'm so excited to see what the future holds on down the road here.
well, and it's I think it's cool that you're a tinkerer because, I mean, I'm a tinkerer, and like we all think
Yeah.
of like people like ourselves, right? But
Yeah.
but you're right. Is they'll bring things to market sometimes, and people, like training is so critical, and oftentimes people
Yes.
get half trained, and it's like I saw a survey one time that Microsoft did, and they said that of all the features, this was about Word, of all the features that are built into Microsoft Word, and this was probably 10 or 15 years ago, they said super users only used 20% of the features. And when they asked
Huh.
them, why don't you use like the other 80%, they were like, I didn't even know it would do that. And if you're a tinkerer or if you have the time to tinker, that's one of the critical pieces. You find those little things that nobody told you about. And
Hmm.
so I love the fact that you're doing these training programs where people get, hands on and then they
Yeah.
get that support afterwards because, that's the other thing. I think about implant placement a little bit like I do about endo, which is, you can go to a hands-on endo course and okay, yeah, I get the feel of the system, and I'm working on either some extracted teeth or some blocks, and I get the feel of the files or whatever it is. But then when you get back to your office, you don't have an endodontist, that taught the
Yeah.
course that says, "Oh yeah, ring me up," or we'll hop on a video conference and I can talk you through it. And so
Mm,
people, if they struggle at all, they just use that one little bit that they remember from their training. But
mm,
you guys are training people and then providing them with support going forward, so that
yeah.
they do get a hang of how to do this. Tell me about what you're doing with Arch Intelligence, because I think that's awesome.
Well, that's our phrase for that is teach to reach, which means
I like that.
we're we're filling in the gaps that schools and continuing education and the academies, they're very, very good, but it's a whole lot. But in reality, again, if you look at the landscape, like 85% of general dentists, who are the gatekeepers, who really are the gatekeepers,
Yeah,
85% of dentists don't place their own implants, or which I get that. I understand why. The younger crowd, they're going to place implants, and
yeah,
that's good. They're embracing they're embracing things. They're just going to do it. Um, it's the technology. The technology is opening up doors. It's giving us belts and suspenders, so that we can mitigate risk, increase confidence, competence, and consistency across the board. And that's kind of what we're gunning for, because there's just a big missing link, uh, between now and the future of dentistry. And that's why I'm so excited about that, because I think in 10 years we're going to be doing a whole lot more implants, as we should. And it's all comes down to training. In fact, we had a meeting last week. We had about 35, 40 folks, that we did our first AI summit here in Nashville. We've done it in other places, and we even had a couple of D4s from
nice.
UT come up, and we really were like, "Hey, tell us what they're teaching y'all. How are they doing stuff?" And they're teaching them the same way that they taught me in dental school, which is the same way they taught my dad, which is probably halfway close to the same way they taught my grandfather. I'm like, "Hey, we need to kind of up our game here." And so it's we're getting there. Everybody's getting there, but what it really boils down to, it is hands-on training. We give it we not that we dumb it down, but you have to dumb it down for me. And we're starting at the base level, making sure that doctors that use our systems are proficient. Um, and what we did at our meeting the other day, we even showed some what's coming over the horizon, which is, with the
Beautiful.
AI optics and
Yep.
Mars and surgery systems, like Da Vinci type systems for dentists, which are they're pretty much here. And so and that's the funny part, because people just there's no there's no central place where someone can come learn about technology. To be honest with you,
Right.
your platforms and your programs have long been, if I looked about things, I'll be like, well, Fluky's kind of the guy that knows about technology, and but that's kind of it.
Yeah.
Otherwise, we go listen to the manufacturers, and you may or may not get exactly what you're needing and wanting, but it is the training. You're exactly right. It's the training that makes all the difference.
Well, because I've said this probably dozens of times on the podcast, but my grandfather was a bit of a philosopher, and one of the things that he said once that really stuck with me was, he said, "Son, experience is what you get 5 seconds after you needed it in the first place." And and that is so true, because that goes
It's
back to the
so,
whole thing of learning from failures. But
yeah,
being able to teach people, when you see somebody do something, you're observing them in a hands-on situation, you see them do something that they shouldn't do, and when you can tell them, okay, you don't want to do that, and here's why, and then you've got, if you're like me, you always got the story, because I did it that way and I messed it up really bad. And then that helps people process that information, of not just this is the way you do it. Don't do it any other way. I learn better when people are like, this is the way you do it. Don't do it any other way. And here's why. Because if you do it the other way, you know,
You,
it's not going to work. And this is what happens. And this is, you know, where the car runs off of the road or the train jumps the tracks. And I think that's just a great way to learn, as opposed to kind of the way I was trained, which was, I mean, I I got myself in so much trouble because I would always ask, well, why? And, you know, the usual answer when I got trained was because I told you to.
yeah,
Um,
me too.
yeah.
Yeah.
And really what I meant was, I just want to know, why do I have to do this? Because what happens, you know, what goes wrong if I don't do it that way? And
Hmm.
people always took it as me questioning their authority or questioning their knowledge. I was really, in the big picture, of course, I was a young buck and I didn't think about how to phrase it. But really what I meant was, I know like, I want to know why you're doing this, so that then if something comes up to me that's like outside of this, I can apply that, you
Hmm.
know, somewhere else.
That
You know,
that's such a well that no that's such a great that is such a great view of the way to look at stuff. And the funny thing is that this is why you and I get along so well, because you and I were both trained this way.
yeah,
Stay in your lane, you do it this way, this is the way it's been done forever. But in reality, uh the that's in dentistry, I guess, and it's probably in medicine too, I would imagine. Um, but in the innovation world and in the startup founder world,
yeah,
that's the opposite of the way folks think. And when you're asking, I love that you go, you say, hey, well, why? Because you're trying to figure out, hey, maybe there's a better way
yeah.
that nobody's really considered. And that's kind of the way I think about things too. And it's funny, the pushback that
Yep.
I've received. I mean, I read books like The Innovator's Dilemma or Crossing the Chasm or
Yeah.
Built for Tomorrow, and they talk about these things. But the funny thing is, we get into institutional type settings or the authorities or the academics. Ooh, buddy, that ruffles feathers. And they said it in the books, and I was like, well, surely not, but in reality, that's the way it is. And I think and this is awesome because I think that right there is the paradigm shift that is actually going on at this very moment, and it needs to happen.
No, I completely agree with you. You know, I understand the educational institution's point of view, which is they're trying to
Mm.
spin people up in, you know, in a non-severe amount of time. They've only got, you know, so many days that they can train people.
Yeah,
And
they're going from 0 to 1, and they got to train people to get to 1. Yeah, yeah, I agree with that. Yeah,
yeah. And so consequently, you know, I think it's probably easier to just say no, always do X. But the problem is, when you only know how to do X, and then you're faced with X plus one, and you got
yeah,
to think
right.
outside of that.
Yeah,
You know, you either got to be really good at figuring problems out, or you're going to be stuck, or you're
yeah,
going to be, you know, winging it when you shouldn't be.
yeah.
And so you know, it's the old thing of being a continuous student, being trained, and all that kind of
Tell me,
stuff.
tell me this if you would. I'd like
Sure,
to hear your thoughts on this. What do you think? Now, I'm not talking necessarily dental school,
sure.
but postgraduate past that, where a doctor wants to learn whatever, wants to increase their skills and they understand, and I think it's very appropriate today and going forward. What do you think? What do you see are the real good ways or programs for folks to, yeah, especially younger docs, to come out and learn?
You know, I'll tell you, one of the things is a GPR, and the reason I bring that up, first of all, is number one, there's a
Hmm.
lot of them, but I've worked with some docs right out of school, and I've worked with some docs right out of residencies, and the difference is noticeable. And I think
Mm.
the reason is in the residency, you're a little bit more autonomous and you've still got people guiding you. But I think that's important. That would be the first thing I'd say. I mean, and you probably know this, Mark, but New York now, unless I'm mistaken, I
Yeah.
believe you have to have a general practice residency to get a license in the state of New York.
You
And
do. I actually had a
okay,
doctor that worked with me for a couple of years, and she ended up down here because she came to UT to get her residency, and she actually stayed down here in Nashville. So yes, that is a law from about
okay.
6, 7 years ago.
But I do think too some of these courses that people have where you do go and it's like a continuum, where you spend, one weekend a month for like 6 months or 12 months, and
Hmm.
you're in the same environment with the same instructors, and you learn a little something, and then you go back to your office and you apply that. And then you come back and you learn a little something, and if you want to, you can bring some of your stuff back and get it evaluated. I
Hmm.
think that is really great because when we learn things, I don't remember the statistics, but it's like we only remember like 10 or 20% of, when we try and cram something into our heads, we don't remember it all. And
Hmm.
it has to kind of, marinate in the skull for a while to really catch on. So I think feeding in small pieces and then being able to come back, or even places that teach like level 1, level 2, those kind of things where you can learn in smaller chunks, and then once you've
Hmm.
digested that then go on, as opposed to something where you go somewhere for 2 or 3 days, it's really intense, but they take you from 0 to 100, and
Yeah.
it just doesn't seem, for most people, and I include myself in that,
Yeah.
it's much harder to get that full comprehension. You just don't get that unconscious competence where you just do it because you just know it, as
Yeah.
opposed to having to think about it and process it.
Yeah, that's what I found, because I didn't do a postgraduate
I didn't
GPR or
either.
anything like that.
I didn't
I
either.
just went in and my dad showed up. He's like, "All right, I'm gonna show you how to do it." And it's
Well, you
mentorship.
know what? In all seriousness, with your dad, you kind of
Oh
had
yeah.
one a little bit.
Yeah, no, I agree. Oh, it was
Yeah,
it was a real one. Yeah, you're exactly right. I agree with that. But not every doctor's lucky like that. And even, especially now with corporate, it's not that I'm worried about stuff, but I'm like, man, it's just a different world. It
it
just
is a
really
different
is.
world.
Yeah.
Yeah. And I mean, I was just the opposite of you, where I got out and I worked for a year in another office, but I was an independent contractor, and the doctor that owned the office wasn't there when I worked,
Mm.
only occasionally. And so I kind of got out of school. And then I was there for a year, and then I opened my office. Now I had to build it from scratch, and I don't mean so much the business, although I did that too, but I had to build the knowledge base from scratch.
Yeah,
And
sure.
nowadays with the ability to hop online and join groups and communicate electronically, and then now that we're bringing in things like AI, where you've got I'll throw out the name Trust. Bernard,
Mm.
the founder of Trust, has been on here,
Yeah.
and the ability to have something like that where it's like a colleague, or connecting with human colleagues. Anyway, I'm just so excited for people in this connected world now, because they've got tremendous opportunities that I never had. I
You
mean,
know, it's so interesting you say that because, my big thing is AI optics here with the
mhm,
meta glasses.
yeah,
And then we're introducing the new eyes loops here real soon. Uh, with the new, I don't know if you know this or not. I've used these for 2 years, just like loops. I love these things. I'm able to take a video, take a picture. I can hands free, voice activated, send it to a specialist, to my buddies or whatever. But now and this, I'm really excited about this. I'm trying to get a hold of the new. Ray-Ban display glasses. I don't know if you know this or not. Literally, I'm not kidding you. You could be, if we both had a pair of these things, you could be in your office doing a procedure. I could be
Okay.
in my office doing a procedure. We could literally live stream, and each one of us could see the other person's point of view in the display in the lens. And I'm talking about live whatever. And I mean, I've already tested them. They're starting to come out on the market. They're phenomenal, and nobody really everybody looks at it as a cutesy retail item. It'd be
Right.
advertised on the Super Bowl and all that stuff. I'm
Yeah.
looking at it going, hey, I use these for teaching and surgery, but in reality, it opens up the portal for. I mean, it's super easy to use, and that's to me that's just amazing that I can see what another doctor sees, and then we can talk about it in real time right then and there. To me, it's like, hey, well, we should really look at this and try to, build upon this AI, and it's all AI technology. Without that, we wouldn't be able to have it. So
Well,
there's,
and, when I think back about like in the early '90s, there were a couple of companies that would occasionally do like live patient things, and I remember I was at one, and the audience was in one room,
yeah,
and in the other room, it was basically a TV studio. There was
yeah,
a
yeah,
dental
yeah,
operatory, but there was like tens of thousands of dollars of equipment
yes,
coming out of the rafters that came down, these huge cameras.
yeah.
And you've now, I mean, what you just said, we basically condensed all of that down to a pair of glasses on your face that can wirelessly transmit, back and forth.
And it's voice activated. It works through the LLMs. It works through Meta or Llama 4 because you have to have an LLM that does the commands
Right.
and that kind of thing. And it works pretty seamlessly. It's amazing.
Well, and you had told me that you're also working on some systems of augmented reality.
Yeah.
So,
Well, and that yeah, and that's the and we can talk about that. Basically the Meta and Ed Zuckerberg was at the meeting that we had before too. Ed and I have
yeah,
talked about a bunch of different stuff, and in reality, Meta and his son Mark is one of the, if not the major driver in the world of actual AR glasses and wearables and use. And Meta is doing an extremely good job of it. The Meta display glasses were the real first venture into true AR. Okay, just for the listeners, okay, there's kind of two things. VR is virtual reality, which is like the goggles, using for gamers or watching a movie or something like that. You can't see your external environment.
right.
Uh, AR or MR, mixed reality, is where you can wear glasses like this. You can see your environment, you can see your surgical field, and you also see computer generated either a holographic type presentation or a screen, and it's working very well. The next level that's coming out is true AR, which is and this is what I'm just giddy about because and in actuality, I'll tell you this, Ed's the one that pointed me in the right direction. I don't know, we were talking about something a good while back. He said, Mark, you need to look at Mars, medical augmented reality systems, and uh, they're out of Tel Aviv, and they're software savants, is what they are. A lot of softwares, a lot of developments are coming out of Israel.
Yeah,
Uh,
smart people over there.
well, what these guys did, Ariel Schusterman and Zach and their guys, uh, he was an F-16 pilot that specialized in missile guidance systems. So they've got Top Gun, they've got the
Yeah,
visor with targeting systems.
Right.
So after he came quit becoming a pilot, he goes he was a dentist. He said, well, if I can guide a missile there, I can guide an implant here. And so they developed a targeting system which is similar in concept to the digital navigation of Yomi and XNav,
Right.
but they created it for wearable AR glasses. We're calling them glasses for lack of a better term, or headsets.
Right.
And they knew that the hardware was going to be coming out and developing uh, very rapidly, and it's kind of here. It actually works. They use it in Europe, and it is amazingly accurate. But more importantly, it's very cost effective, and it's not kludgy or a pain in the butt to use like a big robot with arms and stuff, and the clip goes off or whatever. You're kind of screwed.
Right.
It's just the technology is getting better every day, and so that's the part that's the thing that really excites me about the future, because what that does is it opens up the world of implants. It democratizes implants for both doctors and patients. It opens up the world of implants to, and we talk about 38 million people who are edentulous. Dude, there's another, we pull 200 million teeth a year in the US. I don't even know. And it's just, there's just a massive quantity of people who really could use some implants if we could deliver it in an efficient manner.
A couple of things on that. Number one, I've got an implant on number 14. And
Yeah.
after I had it done, I had it restored. I would tell patients, I said, my whole career, I would sit and talk to patients. And if they were about to lose or had already lost a first molar or a second premolar, I'd always
Right.
tell them, 80% of your chewing efficiency comes from
Right
that
there.
area in your mouth. And I could spit that statistic all day long, but I'll tell you what, when I lost a first molar, that was a whole different definition for me. And I was never so glad as when I got it back. How people function edentulous or even partially edentulous is just like, it's almost beyond my comprehension now, having been through just a little tiny smidgen of that. The other thing I wanted to mention is just the whole visionary part of how things work. I remember when I think this was even before. It might have been. I don't know if it was like right when they first created Meta and kind of changed things from Facebook to Meta. But anyway, I remember that Mark bought a the VR company, and the name of the company.
Oculus.
Thank you. Yeah, he bought. I figured you'd remember. He bought
Oculus.
Oculus, and I remember that there were so many people that were like, "What's he doing this for?" He's a social media
Yeah.
company, and now they got all
Yeah.
of this. And you know what? 10 years from now, or maybe less, I am so looking forward to telling people, "Yeah, that was a really bad idea, wasn't it?" You know. But he had the
Well,
vision, you know,
yeah.
and he had the not only the vision, but he had kind of the intestinal fortitude to say,
Oh
I don't
yeah.
care what, I don't care what the Wall Street Journal says. Trust me, this is going to be something. And, now we've gone from, I mean, those original Oculus headsets, Jiminy Christmas, it was almost like being a medieval knight with a helmet on, to the
Yeah.
point of now putting that kind of tech into glasses that if you're not paying attention, you don't even know that they have that hardware in them. You
Yeah.
know, I mean, you and I, we were talking to Ed Zuckerberg at that meeting, and Ed was wearing a pair of these like super cool glasses, but they were all hardware enabled with all kinds of cool features. I mean, you couldn't even tell. So,
That's what I'm
it's not
wearing
like
right now.
yeah, okay, there, perfect example.
I've got
Yeah,
them on right now. Yeah,
yeah,
he had the same model on. Yeah, is you're exactly right. It's and Mark had the vision
Mm-hmm.
10 years ago,
Exactly.
and everybody did say he was crazy, but now I personally think it was a crazy, brilliant move
It was the right
because
kind of crazy. That's
it
what I like to
was
call it. Yeah.
absolutely. But and everybody looks at it as AI optics as general kind of, oh well, I'll use them out in the real world. It's more of a cutesy thing, is what
Mm-hmm.
a lot of people think about. Use
Yeah.
for so I can post stuff on social media or whatever. Yeah, that's
Yeah.
fine and dandy. But the way we look at it, and Ed looks at it too, and this is what he and I have been talking about. Hey, how can we take this amazing technology, this tool, apply it to our area, implant surgery, or,
Right.
I've got assistants that use them, inter-office communications. My front office guys use them. I mean, it really does create a huge amount of efficiency and saves time, effort, and energy. Um, and it all boils down to back in the day, he saw, this is where things are probably going to go. He was willing to
Mm-hmm.
take the risk on it. And I think they've sold like 2 million of these pairs. They're gunning for 10 million, is what they say. And now everybody else is trying to catch up. But
Yep.
it's going to become ubiquitous across the land. I mean, not just here. We've got people using them in, like I got people taking them to Guatemala to our hospital for missions. I've got them going over to India. A lot of doctors over there, I mean, they really pick up a lot of technology. So, and that's another whole component. We get focused on the U.S. In reality, the global market, the rest of the world gobbles up technology a lot better than we do. And what it does is it levels the playing field. It ups their skill sets and knowledge also. I mean, even
Oh
stuff like,
yeah.
I mean, even ways like it can translate English, Spanish, French, Italian, and German. And I've done it here in the office with patients. And it translates on the fly. These glasses do, and here in Nashville, we're getting more and more people from all over the globe. We used to be a
Sure.
bunch of rednecks. Now we got people from all over the world, and so the ability to speak, with my
Oh
patient and have
yeah.
a conversation is invaluable to me.
You know, I used to do when I got out of school. I went to UMKC. I grew up in Kansas City. I went to college in Kansas City. Went to dental school in Kansas City. I practiced in the Kansas City area. I never left. But anyway, when I got out of school, there's a free health clinic here in town, and they've got a dental clinic. And for I don't know, I think it was like 7 years, I volunteered at the free health clinic, and we had a patient come in one time, and guy came in, he brought his mom, and she was, I don't know, probably in her 80s. She was from Iran. She spoke Farsi, only Farsi. Her son spoke Farsi and German. I happened to
Huh.
have a volunteer dental assistant there who spoke German and English. So we sat down because his mom was having a toothache, and she would tell her son would tell the dental assistant would tell me, then I would tell the dental assistant would tell the son, and the son would tell the mom. I'm exhausted just going through that one time, explain it to you. It took us like 2 hours to get anything done, and now to think that you can put some glasses on your
Yeah,
head and have a conversation with somebody just like you and I are having a conversation now. I mean, that's
yeah.
incredible.
It is, and what it does is it opens up access to care for
Yes.
so many people, and we don't. And again, back to the previous conversation we were talking about. A lot of times doctors, say, "Hey, this is it. Take it or leave it. We don't really
Yeah.
care." You know,
Yeah.
talk cost or whatever. And we don't. We need to give alternative, possibilities. We need to
Yes.
have discussions for these folks. And so, yeah, the technology is leveling the playing field, but it's increasing access to care dramatically. Yeah,
Yeah. I've always felt that when I'm discussing treatment with a patient, I've always kind of felt like I'm a tour guide. And basically, the thing is, here's the things, here's the sites we could see today, but you tell me if you have an interest in this or this.
Mm-hmm.
I'll tell you, what the good and bad about that is, or I'll tell you if we can do that or not. But in the end game, it's the patient that matters. It's the patient's decision. I mean,
Yeah.
we all see patients where you're like, well, you could, you know, we could try and do a big filling on this, or we could. It's probably, we do that. It's probably going to need a root canal. We could do a root canal. We could do this, or you could extract it, and you could do an implant, or you could do a bridge. And we all know there's some people that are like, all I can afford is to be out of pain, get the tooth out.
Yeah.
That's all I need. Well, that's fine. But they need to know their options because
Mm-hmm.
you can't make that decision for them. And I love this, leveling the playing field of people being comfortable going places, knowing that it's not going to cost, $10,000 just to walk in the door, only getting
Yeah.
one solution when, I think it's kind of funny, the old expression, you see 10 dentists, you get 10 treatment plans. And that's probably pretty close to true.
Yeah.
But I would love it if they would go to, 10 dentists and each dentist would give them 4 treatment plans.
Mm-hmm.
Then that gives them a better idea of where they are as opposed to a take it or leave it, kind of situation because we're all different. We've all got
You
different
know that
needs, different desires, different fear levels.
that's the part that kind of excites me. You mentioned trust. Trust.ai,
Yeah. Yeah.
trustdental.ai, and that's a lot of what they're doing also. And it's just and all of this put together, what and I refer to this in my lecture. I mean, I just kind of make stuff up all the time, but I refer to I mean I just do because it's never been done before. But I refer to this as the digital revolution of dentistry. And
Yeah.
I really do think I think that it's true. I think that the digital revolution of dentistry is going to I mean it's a deep blue sea. I mean it's really
Yeah.
just a paradigm shift in the way it's been done forever. And so that's where the actual and without these advancements in technology and innovators, whoever invented it or brought it to market or whatever, without them, we'd still be kind of stuck back doing,
Yep.
what we've been doing for 125 years or whatever. So I get excited about it.
Well, and I think rightfully so. Um, I like to say I was born right on time because I love technology, but I love the fact that I started for the very short part of my career, but it was totally paper, it was totally analog.
Oh,
And
that's
I've
where I
seen,
started too.
okay, yeah.
I mean, filling out claim. Oh, I was thinking about that yesterday. That was my first job. My dad stuck me at the front desk, excuse me, and then I would assist, and then I would go up and fill out the claim and send it in so we could hopefully get paid. And looking back on that now, it's like, gum, that was terrible.
Well,
But
yeah, and you look at, I
yeah,
mean, I love because now obviously you're just like me. I just love looking back and seeing how much better it's gotten. And
yes,
my only regret is that I'm not going to be around in 40 years to see where it's going because it is truly a digital revolution. I mean, we are now to the point of that one of the things that kind of gets me a little bit is the phrase digital workflow because that's been so overused by
yeah,
marketers, but we truly now have a 100% digital workflow for things, and it's only going to get better.
yeah.
It
It's
pretty much
only going to get better. That's right.
yeah, it's going to get easier. It's going to get faster, and the accuracy, all of that. I mean, it's such a great time to be alive and to be in our profession because it changes constantly. I mean, goodness gracious, if you were Rip Van Winkle and you went to sleep for 6 months and you woke up, there there are radical things that changed, in the 6 months that you were checked out.
And that's the part that really amazes me because everybody thinks I'm just kind of wacky and crazy. Because well, I'm telling I'm like, hey, look at this, and they're like, oh yeah, whatever, blah blah, and I keep and we use the term AI,
Right.
and people hear AI and it just like freaks them out. Well,
Yep.
in reality, I think back to, dude, this is January or February 2026. I think back a year ago that I thought, man, we're getting the numbers of innovations coming out consistently. I remember saying back a year ago, thinking and saying, wow, we're getting a new innovation about every 3 4 weeks here. It's really
Yep.
great. Now it's like, holy crap, if you blink, you're gonna miss
Yep.
6 things. And that's a good thing. And
Yeah.
so and by the way, I loved your tsunami analogy. Remember you were talking about that? I was
Yeah.
talking about the technology tsunami, and
Yep.
then and I was talking about, well, the tsunami's coming, and you said, the tsunami's on its way, and Dennis, we're already laying on the beach, and we don't know it's coming. I'm like, yeah, it's right. So it is fomenting and growing at an astronomical rate, and I'm just kind of like, wow, let's see what it's gonna look like tomorrow. That's great.
So I don't know if this is a true story or not, but I'll tell it. But a friend of mine who's a bit of a Beatles fan, he told me that supposedly when the Beatles came to the US and did the Ed Sullivan show, I guess they were in America for like 2 weeks then or something. And they were in Miami and they were at a hotel, and the story goes that Ringo was like out by the pool sitting in a lounge chair, and he told somebody, I'm going to enjoy this because it can't get any better than this.
Right.
In
That well,
64.
that's amazing. Well, I bet he did think that.
Oh, I would
And
have. Yeah, absolutely,
yeah,
I
I would
would
have
have.
too. Oh gosh. Wow, that is a scary component on the backside for me. Now it's like, oh gosh, what's it gonna look like in 5 10 years? That's great.
Yeah.
But you're exactly right. I would love to talk to my grandfather. He graduated in 33. And
Wow.
he in the 60s and 70s, he was down the road from Hilt Tatum. They didn't know each other, I don't guess. But I would love to pick my grandfather's brain and say, "Hey, what did you think about Hilt Tatum and those guys over down the road dreaming up these implants?" And just to pick their brain, because that's kind of where we're at. We're like Ringo sitting there thinking, "Wow,
Wasn't it?
yeah,
Yeah.
this is kind of fun. It really kind of is."
You know, the number one thing, and I've had several people verify this for me. I've never seen it written down, but I've had a lot of older dentists who are like, "No, that's true." So supposedly, in World War II, think about this: World War II, everybody in America wants to fight the Nazis. We're talking about men that were going to fight, generally speaking, like 18 to 25 years old in the prime of their lives. The
Yeah.
number one thing in World War II that disqualified men from military service was they had to have 6 maxillary teeth and 6 mandibular teeth that occluded when they bit down.
Yeah.
You think about that: 18 to 25 years old, 12 teeth. And a lot of
That's
them didn't
funny.
even meet that standard. And then you look at
That's
today. I mean, look how far we've come.
that's amazing. My grandfather, he literally closed his practices in 1941. He had two offices down in Alabama. They closed up shop and he went into the army and got those guys off to the Pacific is what he
Wow.
did. But I
That's so
remember that
cool.
if you didn't have enough teeth to actually occlude and chew, they
Yes, to
were
chew.
afraid you were going to they were afraid you were going to get out in the field and you literally couldn't eat.
Yeah.
Isn't that crazy how far we've come since then?
Yeah. To think, I mean, 18 to 25, that's, like I mean, somebody comes into I would think almost any office nowadays at that age, and they've only got 12 teeth left, I think the first thing we would be like, what happened? Did
Yeah.
you, was it some kind of illness, or was it some horrible accident, or, whatever? And it was like, no, they just, I got, big cavities, or got gum disease, or whatever it is. It's just,
Sweet teen cokes. Yep.
yeah. And, and now we're superimposing radiographs over the patient during live surgeries, guiding the handpieces.
So this is such a great conversation about what if on down the road.
Mm-hmm.
That we ought to come back in about 10 years and revisit this, have the same conversation. They say now, we
Yeah,
predicted this stuff on down the road. Now, how was it applied to the problem that we have of edentialism or whatever? And I would love to say that they're going to be millions more implants placed, not just in the U.S., globally,
right.
across the way. And I think it is going to keep growing and keep growing and keep growing, because I think obviously the technology is going to give us skill sets and I say superpowers. That's a little
Yeah.
bit strong term, but
I don't
nevertheless,
know. For me, it is, so that's okay.
yeah.
I'm
I mean,
all about
I don't try to.
superpowers. I'm good with
Yeah,
it.
we're just trying to get by, but it's going to be interesting to see the end result about how much generalized longevity it delivers to the populations,
Yep.
because it's a one-to-one, it's almost a one-to-one equation, if you ask me. If you have teeth, obviously life's going to be better, but you're going to live longer. And if we can
Yep.
use the technologies and slow that train down,
Yeah.
that's I think that's a real thing for mankind.
I do
So
too.
that's
Take care of each other. That's what it's all about.
yeah, yeah.
So, Mark, we're butting up against an hour here. So, real quick before we wrap up, tell people how they can find you. How can people get in touch with you? How can they, sign up for your courses at Arch Intelligence and such?
Well, I'm around. I'm down here in Nashville doing teeth as fast as I can. Uh, I my startup. I formed a base called Whitefield Biomed, whitefieldbiomed.com, and it's our base of just it's my ecosystem
Okay.
biohub for the new innovations. And so this is where we kind of blast information out about stuff, and we're getting ramped up a lot more. Our education and training, like both hands-on and online, is we're forming that under Arch Intelligence, and
Okay.
that is focused more on addressing this unmet need of edentialism and giving doctors training to be able to actually take it back to their offices and implement that. So you could reach out to us. I'm available all the time. I love talking with people all the time, online, on the phone, email, whatever. So reach out anytime. I'd love to collaborate.
All right. Well, Mark, thank you very much, everybody. Thank you for watching. Like I said when we started, we're always looking for guests and comments. So, like, comment, subscribe, all of that stuff. I want to say thank you to Medidenta Digital, because if it wasn't for them, I wouldn't be able to do this. So, shout out to them. I'm Dr. John Fluke, Technology Evangelist. This is the Technology Evangelist podcast. We will see you next time. Thanks for watching.